Next, we're going to take a live question from Eric in Lakewood, who has a question for Rep. Bronoske about the health disparities bill.
Thank you. I appreciate your time. My name is Eric, and I'm a dad of a daughter and two sons. My question is for Representative Bronoske. This year, there was a bill in the Healthcare Committee about making some changes to our Health Disparities Council. First of all, I do really appreciate what you said during the executive session on the bill about the need to take seriously the struggles that boys and men are experiencing, that you want to see a commission on boys and men established, and that commission should then have representation on the Health Disparities Council. Can you talk about what you see the remaining barriers are to getting a commission on boys and men established, and also if there's a potential for some kind of bill focused on boys and men's health that could go through the Healthcare Committee? Thank you.
Hey, thanks, Eric, for the question. Hey, I appreciate the comments. This is something that I agree with you. There are disparate impacts currently facing young men and boys in society and certainly across the United States of America. What I said in executive session remains true. Men are more likely to become addicted to substances, more likely to commit suicide, and we're really struggling to find economic opportunities. And I will say that empathy is not a zero-sum game. As some young men and boys are falling behind, it's not at the expense of anyone else. This is something where a rising tide lifts all boats, and in this instance, we want young men to be productive, happy members of society that contribute to the greater good. And there are things that we need to focus on where young men are falling behind to lift them back up, to help them along. It's about giving people opportunity, and this is an instance where I believe that a commission on men and boys could be helpful to look at some of the things that could be contributing to those disparate impacts that are currently facing young men in society. Your question is specific to the Health Disparities Council and a commission on men and boys. There was a specific bill that's been introduced over the past couple of years now, this year included by Representative Mary Dye, that I was a co-sponsor on, that will establish a commission on the interest of young men and boys to address some of those disparate impacts. Unfortunately, that bill did not move out of committee this year. And with the Health Disparities Council specifically, I think it is most important to have the commission established first, and then updating the Health Disparities Council to add additional seats to have that representation on that particular Health Disparities Board. Quite frankly, I think the biggest hurdle, unfortunately, is the budget. This year's state budget has a lot of, we're having a lot of issues with the budget. And to stand up a commission like this, albeit it's very important, we have several similar commissions that represent a lot of diverse groups across the state that have unique needs that need to be addressed and met. I think that was the biggest issue. It does cost money to staff up and properly and appropriately bring a commission like this to life and a commission like this on board. I would like to think that when we work with this biennial budget issues, that this is something that we can readdress in the future, because I think not only myself, but several other key members of the legislature understand that this continues to be an issue, and I think we have a lot of room here as a state and as society to address some of those needs and address some of those disparate impacts that are currently afflicting young men. So I'm happy to continue to work with my colleagues in the state legislature and the healthcare committee, but also with the budget writers to make sure that we make this a priority going forward. But unfortunately, it just couldn't happen this year due to the current budget situation. I think that's the largest hurdle. I am confident once the budget is in a much better spot, then we can immediately address these issues that are afflicting young men and boys as soon as possible, because it is urgent. So thanks for the question.